A successful medical cover-up takes everybody to fall in line. And they do, because they risk their career if they don't. They are fired. You know, how many whistleblowers do you know that it ends well for? They protect themselves. Or if they don't, you know, there are some nurses and stuff who have a moral conscience, and they'll come forward. They lose their careers, or they're ostracized, they're bullied.
Now, many doctors and other NHS staff are still too fearful to expose malpractice, even when they fear for patient safety. So tomorrow, a campaign is being launched to try and give whistleblowers more protection. At its forefront is the paediatrician Dr. Kim Holt, who sounded the alarm about problems at the hospital unit which later failed to spot baby P's injuries. In tonight's special report, our health and social care correspondent Victoria MacDonald spoke to another healthcare worker who blew the whistle and was then sacked.
Sharmila Chowdhury was once a radiology manager here at Ealing Hospital in West London. All she can do now is look from the outside in. She has been effectively locked out, sacked after she blew the whistle.
One day we actually had a really sick A&E patient, and the consultants within A&E couldn't find a radiologist to get advice, and I looked at the roster and there were supposed to be consultants there, and then after looking even further I discovered that they weren't at the hospital, they were actually working at a private hospital while still being paid by the trust.
So all this was times when they were at the private hospital?
Yes.
And these were when they should have been?
This is a serious allegation. Two consultants moonlighting, it's alleged. The trust says an investigation was held and was found to be unsubstantiated. But it's what happened next that is of such concern. Miss Chowdhury, the whistleblower, found herself falsely accused of fraud.
I was marched off premises. I managed 60 staff in the department, you know, and nobody could understand what was going on. It was really humiliating. I was confused. I didn't know what was going on, because when they said, they couldn't tell me the details, except they said, they believe I'm committing fraud. And I said, well, what is it? They couldn't tell me.
Where was the bit that you cross-referenced it with?
So far she has won an interim tribunal. The trust was told to put her back on full salary, and last February she won her appeal against the sacking. No fraud was found, but the trust still refuses to take her back.
The fact is, Ealing Hospital isn't that unusual in the way it's dealt with this case. It is all too common across the NHS for the whistleblower to be punished.
Paediatrician Kim Holt was put on special leave after she raised concerns about safety at a Great Ormond Street hospital clinic in North London.
We shouldn't really need to have this escalation, which we're seeing on a regular basis now. We're seeing, undercover reporting, and we're seeing exposés in the press because people aren't being listened to.
Following baby P, Dr. Holt was offered £120,000 to leave and to stay silent. She refused. The hospital has always said it was not an attempt to gag her. The Public Interest Disclosure Act is meant to protect whistleblowers, but it isn't working. Last year, Channel 4 News revealed that NHS managers continue to use taxpayers' money to buy the silence of doctors and other staff. In other words, to gag them.
Remember the movie A Few Good Men, Colonel Jessup? Who did you order the code red? You're goddamn right I did. But everybody else covered for him. Because they have to. And here's how they get away with it. Radiologists are told to turn a blind eye. Here's one example from 2022, where an oncologist, Professor Prof. Craig Lynch, just gives one simple message in red: no action. Have to have it time-stamped right down to the second, and they never do in mine because it's just bogus. And here, lung bases are clear. Just months before that, they said that I had emphysema, which I don't. They're tumors. And emphysema, if it was that, doesn't just go away. So why is it clear? And then a month later, they're showing subpleural density, so nodules in my lungs, and they're not even measuring all of them. They're not reporting on all of them because I've gathered the reports. Speaking of reports, Let's go back to 2016 when I had one brave soul and I didn't know it at the time. So the woman who conducted my scan, she gave me just one image, and I was like, well, I can't read any of that. So it sat in my closet for 9 years. November 2016, I had a CT epidural injection. And it says right on the sticker, refers preference, MIA direct, no films, meaning don't give the patient her films. And she handed it to me. It's like you have to go back and just re-examine everything because nothing was as you thought it was. Nothing was as it seemed. And this little Asian woman, she looked really nervous. And she was, oh, this belongs to you. I want you to have this. I remember it was odd. I just thought she was a quirky lady. And I took it, and it sat in my closet. And, as you can see, it shows mass spread. It goes back to 2005, where, I mean, that scan doesn't exist, so I'll just have to take their word for it on this scan report that the heart size is normal, no current active lung disease. But I wasn't going there for lung disease. I needed a full workup on why a 29-year-old just suddenly develops night sweats, which continued for the next 20 years. But my psychiatrist, the evil Dr. Helen Driscoll, it was her job to just reassure me and just say, oh, you know, it's just your nightmares, Carrie. Well, I've been having nightmares my whole life, and why at 29 did I start getting really bad night sweats? And with my back, my back started getting worse, and, I'd have pins and needles going down my leg, sometimes my foot, like I couldn't feel it. And she said, oh, little kids' bodies weren't meant to be banged around like that. So there's a lot of, spinal and back injuries with child abuse. And she talked about the daughter that she adopted having similar issues with her back. So I trusted her. It was mass spread. It was cancer ripping its way from breast to spine to pelvis to brain to thigh. It's everywhere. It's coming out my skin now. Pathology reports. So in January 2022, the specimens were taken on the 21st of the 1st, 2022 at 12:36 p.m., but they were processed in the lab 1 week later on the 28th of the 1st. And they get a fellow to do it, but then they rewrite history, and they gave me a right hemicolectomy and a stoma. So I have a bag apparently, which I don't. Pretty easy to prove. And the next time that happens is with Desiree Yap, and she sends my specimen. She doesn't report her findings. She leaves tumors inside me, in my cervix, and doesn't report the cancerous ascites that poured everywhere. And she outsources to a dodgy lab, half an hour away from the private hospital. I paid $13,000 to have that surgery, my God. And at Path Labs, still haven't heard from them. I've requested. So I just keep getting stonewalled. Another 2 laparoscopies where they do more of the same, just amend, edit, chop out what they don't want me to see, don't report on the findings, say that things are benign. And she outsourced the pathology. She sent my specimens to a lab 3 days later to let the cancerous material just degrade, so it's no good. And they had 2 baby doctors, like a fellow and a resident or something like that, sign off because their name means nothing in a court of law, which it'll never get to because they are just as corrupt as the medical system. Oh my God. I'm back to 2022 when I had a colonoscopy and a gastroscopy in Castle, Maine. And they sent my pathology to Austin, even though the Austin hospital had nothing to do with me. It was collected and received at the exact same time, which is virtually impossible, as it was coming from Castle, Maine, and it was the Austin in Heidelberg. That's a 2-hour drive, so I'm not sure how they got it there so quickly. And then once again, because everyone's trying to give me benign conditions, so this one is, they're trying to try to make it mental. So this one, they've downplayed everything. They didn't report on what, like, the lesions or anything. They tried to claim I abuse laxatives. So this mild focal melanosis coli is what happens when somebody abuses laxatives, and I have never abused laxatives in my life. And they don't report on the lesions that would be all over my bowel, because I've seen the images. I'll spare you those. See how my nose is getting misshapen, discolored, where the tumors are growing underneath it. Inside, because it's a mucinous tumor, it grows underneath the mucosal surface. My eyelid now, looking suspiciously similar to the tumor that Desiree Yap hacked away at for a little bit and then just left in my cervix almost 3 years ago. They're criminals. And if I was the crazy one that was lying, why are all these other people, why are these professionals going to such great extent to cover this up? Could it be that it's a cover-up? There's also a tumor in my ear. It's been there for years. So yeah, I am suffering with no help.